Hi guys, and welcome back to my channel. Thank you guys so much for tuning into this brand new video. For those that are new here, my name is Nadine and I'm a qualified midwife here working in the UK. So in today's video, as you guys can tell by the title, I'll be showing you guys how I would prepare an IV drip if I'm about to administer IV fluids for a patient. So you guys have been asking and requesting for these kind of videos for some time now, and I'm here to deliver, and hopefully this will be a new series here on my channel where I show you guys multiple clinical skills that I would undertake as a midwife. So if you guys like the sound of that, please make sure you stay tuned, and towards the end of this video I will also outline the many reasons why you would need to administer IV fluids to a patient, a pregnant mom, or a mom that has just delivered. So without further ado guys, let's get started with today's video. Okay, so let's start with what you will need in order to prepare your IV fluids. So the first and most important thing that you will need in order to prepare your IV fluid is obviously your IV bag. So depending on what the doctor has prescribed or what are you administering to the patient, you need to make sure that it is readily available and you have it to hand before you start preparing your IV fluid. So I currently just have sodium chloride here as a demonstration just to show you guys how I would prepare my IV fluids. The second thing that I have is a giving set. So this is my giving set that we use in my hospital. Depending on your hospital, they may have different types of giving sets depending on the supplier that supplies the equipment and the things that you use clinically. So this is the one that we use when we are administering IV fluids. We have a different type of giving set when we are administering things like blood work, then that will be a totally different giving set. So this one is solely for IV fluids, or if you're giving any certain medication that are going through an IV bag. The second thing that you will need, well, the next thing that you will need is gloves. They don't have to be sterile, and also an apron. And the next and most important thing that you need to make sure that you consider is make sure that your work environment or your prepping environment is clean, your table is clean. If you have a container or a tray that you prepare your medication or your IV fluids, just make sure that the area is clean so that you are working in a clean environment. So let's start by preparing this IV bag. So the first thing you need to make sure you do is wash your hands. Make sure your hands are washed, clean and dry. The next thing you need to do is put on your apron. So if you're doing anything clinical, apron and gloves are needed. Okay, so these are my gloves. I'll put them on shortly. First, I need to open my IV bag. So in my hospital, when we are about to administer anything IV, whether it's medication, whether it's just fluids, it needs to be checked by a second midwife. So before I open this up, I take it to the other midwife so she can also check alongside the drug chart, so that we are both checking that we are giving the right medication, the right IV, and make sure that the IV is in date and it's the correct one according to the drug chart. So the midwife will check, I will also check. So you just need to check that it's within date, it's the right IV bag that has been prescribed, and also check that there's nothing inside the IV itself. There's nothing floating in there. There's nothing, you know, when they were making this bag, they didn't leave any other particles or anything floating in the bag. It has to be clear and ready to go. So once I've done all those checks, I can then open my bag. So opening my bag, I can also have another better look at the bag. There's no holes to it, it's intact, right date, right medication, everything has been checked. So I put on my gloves. So gloves on and ready. I'm going to now open my giving set. So this is my giving set. I don't know if you guys can see that. So this is the top of the giving set, and it also has a section here where I can open and close the giving set depending on if I want to start the fluid, if I want to stop the fluid, if I want to slow it down. This is basically what it's for. And also the tubing and the cap at the end, I can open this when I want to start the IV fluid and connect it to the patient. So that is basically my giving set. The giving set also has a cap at the top. This is the last thing that you will remove. You will remove this literally just as you're about to pierce the bag and attach your giving set to the bag. Okay, so now that you have your giving set and your bag ready to, ready to go, ready to connect the two together, when you remove the lid of the spike, you need to make sure that you don't touch the spike. You don't want to contaminate the spike because it's going to go into the bag, and whatever's in the bag will go to the patient. So you don't want to, introduce infection or contaminate the bag in any way when you are administrating anything to do with IV. Just be careful how you handle and manage your equipment. So I'm just going to remove the cap here at the top. So I just twist it off, as you can see there. Once I've twisted that off, I will then remove the cap. So as you can see, I've exposed the spike. It's pretty sharp, so you just need to be extra careful. And then I'm going to hold the bag like so that I have a good and sturdy grip to it. And then I'm going to just insert the spike through the bag like so, and basically just push and rotate as I go in until it's literally in as furthest as it can go. So that's the bag in. Once I have the bag in, I will keep it upside down because I don't want it all to be flushed straight away because the valve is still opened. So what I'll do now, I will close it. So I'll push it down, just closing it, making sure nothing will literally flush down and fall on the floor if I don't have my cap underneath. Trust me, I've done that while I was a student. So then it's upside down. I've put the bag upside down. What I do, this is my own technique, I don't know if everyone else does this. What I do is then I squeeze this part of the giving set just so I can fill up all the the fluid in this part of the giving set. Once I've squeezed it and it's about halfway full, I will now open the valve. As you can see, the water is now being flushed through the tube. Flush. So that will just basically flush through up until the end. So you will hang this up onto your drip stand, and then you will close the valve again before you administer it. So you hang it up onto your IV drip, and then you will close the valve. Then you will check the patient's cannula. You will make sure that it's flushed and it's working before you start to administer your IV bag. You always have to make sure that the cannula is in good working condition before you administer any type of medication via IV. So I would flush it with some normal saline, and then I will remove the cap off of this. Yeah. While I do that, I will just run it through to make sure that the line is correctly working. So I'm just going to quickly show you guys here. So it's going to, a little bit is going to come out. So as you can see, it's working. So once you realize that it's working, you will hang this up. Make sure that there's no air bubbles in the tube. So you inspect the whole giving set, making sure that there's no air bubbles. And if there is any air bubbles in the tube at all, then you need to make sure that you get rid of any air bubbles. Normally I do this to just get rid of any air bubbles, to make sure that there is none in the tubing. So at the moment there's no air bubbles. The line is completely ready to go, and that's basically how I would prepare an IV bag if I'm about to administer IV fluids. So I hope that video has helped you guys. I hope you guys have learned something from this video. Please do let me know other clinical skills that you guys would love for me to show you. But at the end of this video, I will outline the many reasons as to why women will be needing IV fluids while they're under your care as a midwife. So thank you so much guys, and I will see you guys soon in the next video.